Hello everyone, I want to share this educative video about a routine phaco case. Very important when you start your phaco doing the two paracentesis. Very important to choose where you are going to put it in your rest hands. Then double shell technique is very important because you are protecting the cornea and making the post-operative results second day very good, visco-dispersive, then visco-cohesive. Fashioning the phaco wound very important and usually do at the steep axis. During the capsular rhexis, always do it in 4 steps like I'm going to do it. So you do the first quarter like this and always make the rest of the anterior capsule to the center as I'm doing. This is the second step. Then the third quarter to fashion it in a circular, good size central capsular rhexis. Then you close it from outside to inside to maintain its integrity. Hydrodissection very important under the anterior capsule, and then rotation of the nucleus is important. During the quadrant removal, you do the first quick shot technique and then watch my steps. I always do during the quadrant removal, I usually go on step 2 and rarely on step 3. This will going to decrease your phaco time and protect the cornea from the heat from the phacoemulsification. This increase the integrity of the cornea second day post-operative, and making your results and the patient satisfaction is very important. Always make your phaco tip in the center of the anterior chamber and make your pieces come to you. You don't go to them to decrease the endangering of the posterior capsule, and you see how the phaco time was 3.6. During the removal of the cortex, always do it in a circular manner, not a radial manner, to decrease the traction of endosomules during removal of the cortex. After you remove all the cortex, if you find a PCO like this, increase the magnification, good light, and then polish it. Don't leave it for react post-operatively, and you can remove it easily like this. Just polish, and then you take the sheet of this PCO easily. Then, after you remove it, injection visco-cohesive inside the bag. It's very mandatory to put your IOL inside the bag. Injection slowly. Don't rush during the injection of the IOL, not to go or to endanger the integrity of the bag. The removal of all the cortex behind your IOL is mandatory to have tight adherence of the IOL to the posterior capsule and decrease the PCO and the spike rise of the IOP post-operatively. Very important. Polishing the anterior capsule, very important also to decrease the anterior PCO and the capsular phimosis. Then hydration of the wound is important. Thank you for watching.